This is a presentation on children and youth in healthcare settings. Healthcare issues and hospitalizations introduce significant changes to the customary lifestyle of children and youth. They can face separation from their parents, siblings, and peers. They also must come to accept new routines and undergo strange and often painful medical procedures. Pediatrics is the branch of medicine that involves the medical care of infants, children, and adolescents. The American Academy of Pediatrics recommends people under the age of 21 to still continue to receive pediatric care. Children and youth experience different healthcare issues than adults. Fires and burns and suffocation for diagnostic procedures or things such as wart removals or hormone testing. The third group that can enter the hospital with planned inpatient procedures, illnesses such as diabetes, arthritis, cancer. The first year of life is one of rapid change. During the first 12 months of life, an infant trips birth weight and final words persistent is a result of a fall, burn, or poisoning. Parental anxiety, guilt, and anger become also an issue for the healthcare team. Toddlers in a healthcare setting represent a unique challenge to pediatric staff. The child's skills are developing at a really young age. The children's primary way of learning new skills is through repetition. Toddlers also have a close bond with their mothers, even though the process of separation and individualization has begun. Separation from the mother or primary caregiver remains a major stressor for toddlers. Preschoolers in the healthcare setting also have difficulty separating from the familiarity of home. Hospital stay, the family or a familiar support group is not to the child. Child and times. Time for new initiatives and endless projects, a time to explore the properties of new things and people around them. School-aged children are more sophisticated and have lots of problem-solving abilities. They are to handle an injury or illness better than a younger child. But this age group can also still feel the trauma of the big changes with healthcare problems. Are often anxious to learn about the medical setting and the nature of the illness. On the other hand, they want to be productive. also must come to terms with the fact that the parent is not the person in control. The young adult is moving closer to independence from parents and family. Usually still financially dependent on parents, and in many ways are emotionally dependent on them as well, but they are also becoming increasingly self-sufficient. They are driving to establish an identity, and it's a major concern during this time period. Gain their own independence, part of a family. For children is to enhance self-awareness and positive self-preconceptions, develop and practice social skills to establish and maintain relationships, contribute to overall physical and emotional health, reinforce academic or career skills in a recreation and/or leisure setting, facilitate cognitive growth and development, promote motivation, self-initiation, and responsibility for participating experiences at attendance. TRs are still inclusion and active participation in community-based programs to express emotions and provide input in program development, treatment goals, and the evaluation of TR services. The goals of selected interventions for TR treatment are journaling, community reintegration, creative cooking, expressive and creative arts, leisure education, and many people will not each person. Sometimes you can combine multiple of these intervention and treatment goals to get the same result. It is best to try and allow the child to try a little bit of each one to see what works best for them and allow them to help make the choice in what they feel can help them. You can also work with team members and the parents at home to teach them the different ways that they can help their child make changes and help promote goals in their home setting.